So you guys are here with the Society for Participatory Medicine, which had a big pre-conference day yesterday, and I want to chat with you a little bit about what happened there.
Sure.
You were telling me about the connection between the society and HIMSS and PCHA, and why that's so important.
What's really interesting in healthcare today is there is a phenomenon occurring, which is that healthcare is being deconstructed not by design, but by intent. And slowly and steadily, the locus of care is shifting from the provider, the bricks and mortar of a provider, to technology that is in, on, or about each one of us. And HIMSS and the Personal Connected Health Alliance are integral players in enabling that evolution to occur. What that is doing is empowering the individual and load balancing and sharing of responsibility with the provider. In an era where you have this massive bubble in the population, the baby boomers reaching the high maintenance healthcare years, more than ever, that shift is essential. Now, what's interesting about it is if you think of a physician or a clinician, highly specialized knowledge about A, B, C, D, etc. You and I, and Eric, the rest of us, we don't have that highly specialized medical or clinical knowledge, but what we do have is knowledge about ourselves. No one knows me, how I feel, how my body reacts to things better than me, because I'm the only person who's with myself 365 from birth, 24 hours a day, 365 days a year, from birth until death. I know more about myself than anyone. And this is also a verifiable fact, the most underutilized resource in healthcare is indeed the patient. So what the Society for Participatory Medicine is all about, and this is what our conference was about yesterday, is recognizing that that the journey, my lifelong journey to health and wellness, is not a journey where I am a passive passenger in the healthcare vehicle that's being led and driven by the clinician, but I'm a co-navigator with that clinician, where each one of us understand and respect what each one brings to the table and engage in a dialogue on it to reach the right answer that optimizes my health and wellness, and all of us. That's what the society is all about. And indeed, it is a culture change. However, for the first time, the enabling tools, thanks to organizations like HIMSS, thanks to organizations like the Personal Connected Health Alliance, and the predecessor of Personal Connected Health Alliance, like Continua Health Alliance, thanks to people who have come together to form organizations like this, do we see this progress occurring. So this is the third year that the Society for Participatory Medicine has co-located its event with HIMSS and the Personal Connected Health Alliance, and we look forward to doing it more and in a deeper way in future years.
Eric, what were some of your impressions from yesterday?
Well, it was really fascinating for me yesterday, because this is the first time I've been to this conference. And the most important things that I learned were from some of the keynote speakers. One of the more inspiring people that we heard yesterday was Jamie Haywood, who is Patients Like Me, that's right. And you know that they've recently merged with United Health Group. And he was really inspiring, because he gave people the sense that they really are in control of their own health. And this is the way this is kind of the wave of the future. I mean, for a long time, we gave up our responsibility to doctors and the providers who took care of us. But now we're able to take care of our own health in new ways. And in fact, I'm developing an app called Changeful, which it's for caregivers. It's for the health of caregivers. And instead of people learning about the process of taking care of themselves or the process of caregiving, they learn about how they learn through stories and through videos about how to take care of their own health on a day-to-day basis. There was a word that was used yesterday in the conference, Kaizen, which means baby steps. And that's kind of how our approach. We're going to tell people the information they need to know using stories and allow them to take the baby steps toward good behavior change. And the thing that was so interesting for me at the conference yesterday, listening to those speakers, is how everyone is focused on small changes that make huge differences in all of our lives.
10 years in, you said, it really feels like the society is moving from just beating the drum about how important it is to have this culture change in patients playing a role in their health, but really talking about the how-to and what can we do to facilitate that and make that happen, right? Or it's both, I guess.
It's both. That's right. Another interesting thing about the society that might be relevant to this audience is that heretofore, for 10 years, it has been completely voluntary. That is, anything that gets done by the society has been done by what I would call a coalition of the willing. It isn't individuals who are doing it because they're getting paid. It isn't individuals who are doing it because their employer is telling them this is what you have to do. It's individuals who have a passion and are committed to advancing healthcare.
Yeah, and I'm sure a lot of that is powered by their own patient stories.
That's right. It's really, really inspiring, and it's a good group of people. There are larger organizations that have joined and become members as well. For instance, the American College of Radiology is one. But there are many, many others. I mention that just because of the size of an organization like that. The dues for individuals is $25 for the rest of this month, and then it's going to revert to our normal $50 a month dues. We lower it for the month as part of the relationship with HIMSS. And if there's any individual at all that says they cannot afford the dues, they become members at no charge and no questions asked. And that is, we recognize particularly patients who might be sick. That's the worst time for them to incur additional expenses, and we want them to feel welcome and part of the Society for Participatory Medicine family.